Okay, welcome everyone. You made it. This is an Educo production and a special event, 1 hour live webinar with you and us. My name is Justin Toll. I'm the president at Educo. And today we have a very special topic with a very special presenter. Dr. Davis Brockenshire is with us. And we're going to have a program that's approximately about 45 minutes long in content. And for those of you joining us live, we're going to have a live Q&A session where we can ask questions about the content, clinic, and see what else we're going to get into. So let's get rolling. We call this clinical pearls / synergies, but that's why we have clinicians teaching clinicians and what's working in practice with real world results. And we can get into the fine tuning to get the best results to help more people. And that's what we're all about. You can go ahead, forward some slides up. So first, disclaimer. This is for clinicians and healthcare practitioners. The content is provided for you for educational purposes only. The information set forth therein is holistic in nature. It's not offered as a complete or comprehensive training on all subjects referenced, has not been evaluated by the Food and Drug Administration or any other medical body, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. We offer this information with the expectation that practitioners shall use their own discretion, perform their own research, rely on their own clinical experience and practice according to the scope of their practice and the limits of their license. Okay. Who is this man? Dr. Brockenshire is joining us. We have a national following of different people across the country and practitioners with us today. Dr. Brockenshire joins us from his home in the center of North America, in Michigan. He has a clinic there, went to Logan University, and through all this time, he's the consummate enthusiast for health, energy medicine, athletic injury management, pediatrics, homeopathy, rehabilitation, and it goes on. And we really has put together just a whole host of experience and clinical experience that we're going to find out more about today. And also has a wonderful family and a couple kids in there. And so thanks for taking the time with us to put this together and share with our community at Educo all of these things. So I want to say welcome, Dr. Brockenshire, and thanks for joining with us today.
Thanks for having me again, Justin.
Hey, my pleasure. I'm glad we could do this on here, and I hope to have us in person as well soon. So, and Third Planet, our home. This is a brand new supplement line, and really being harnessing the expertise, the clinical experience and professional grade supplements using technologies from mycotherapy in mushrooms to highly bioavailable extracts. Third Planet is a special brand that we're going to get into. If you go one, you can take a peek at kind of our goals. Not only are we to sourcing professional quality extracts with the research behind it, and making sure that carries all the way through into the final product that we use in clinic. These different herbs and supplements have been put together in a very innovative way that has never been done before. The other thing we do that's a little different is we make sure it has this vital force, and we test that for energetics, and that's something that we believe in. Okay, so let's get rolling.
All right, you're in for it today, everybody. By the way, kudos to Justin and the team at Educo for giving presenters like myself a platform to talk freely amongst colleagues, amongst friends, It's rare today to find a place where we can share our voice, our experiences, our research, and our observations without the fear and, frankly, the irritation of being censored. So we'll keep everything in our lane, right? We're going to stay in our lane. But I've been doing direct to practitioner education now for 15 years. And this is the first year, 2021 is the first year I actually don't have a live in-person event scheduled. It's kind of freaky deaky, but it's very liberating at the same time, because then we have the opportunities to do these things. So some of the stories that I want to talk about today from a clinical point of view are to help you, the practitioner, understand WTF. Okay, we could have called this presentation WTF, but that's not necessarily nice. Your patients are very WTF today. You got a lot of weirdos. I know that because that's all I'm seeing coming in the door. So by the end of this 40 minutes or so, you should have an understanding of how do you want to handle the strangeness, and more importantly, what can you do about it? Because I've been saying this for several years now. It's not business as usual. You can't protocol your way out of trouble, but you can definitely protocol your way into trouble. Okay. And I had a patient, a reactivation. I hadn't seen her since 2012. I had her in yesterday. And when I got done my workup, she just looked at me. She had a little tear in her eye, and she's a practitioner. And she said, "This is nothing like I was expecting. Where did that come from? You just don't stop learning. How do you do all this?" Well, the answer is simple, because we have to. And that's what we love to do. So hopefully we're all a little bit on the line of a pathological learner, which is good for our clients and our customers and our patients. So what I want to start with, and the team at Educa was very generous to kind of do some style design for this presentation today. I love this graphic because it's so about what I want to talk about. If you've heard me talk before in different settings, you may have come across this concept of what we call left spin, right spin. And so what I'm going to do for you today is clarify that, bring you up to speed on what it all means, and give you the direct translation from a physics point of view into biology, so you can understand pH a little better, and also the relevance of this concept today with our authorized but not approved injectable medicines that are being rammed down our throat, because those types of drugs cause a left spin dysfunction systemically. So what does that mean? Well, essentially left spin means the cells went, holy smokes, and they closed. And when a cell closes, you can't get good information in, and you can't get waste material out. So we call it left spin because that's the spin of the photon. All right, we're talking about light, photons going around the cell membrane. And not to bore you to tears right off the bat, but for those of you that are new to this, we can measure these things at a cellular level based on how ions move in and out of the cell membrane. So as you know, our cells are bathed in fluid, right? That's our extracellular matrix. And that's typically high in sodium. Inside the cell, we've got potassium. When potassium and sodium switch places, you get a charge. So there's your ionic charge. So when somebody says they have ionic minerals, that's what they're talking about. It's charged. And if this system gets compromised, you can't get those minerals to change places. And that becomes a problem. So for those of you that do any kind of energetic testing, whether it's EAV, muscle testing, functional neurology, people in left spin are those that are typically switched or blocked. These are the kind of patients that they might do well on a program for the first few days, and then it backfires. So the kind of patient that starts something and has progress, or progress for the Canadians out there, and then it backfires within a week, they're typically in left spin. And so what's happening is their system cannot accept new information, and it also can't release any stored poisons. Anybody that's complained of a die-off effect, the dreaded die-off, that's not really what's happening. Essentially, their system's becoming too acidic and their immune system overreacts to the poisons that are in the extracellular matrix. So I'm not talking about electron spin. We're talking about photonic spin. Okay, so this is where all of the physics around light comes into play. For those of you that love playing with light, our light workers, including those that love lasers, you'll notice that lasers can correct a left spin immediately in the office. Your job then is, how do you keep the patient from going back into left spin between visits? And that's where we come in. That's where nutrition comes in. So if you've got patients that are always sore after treatment, chances are they're in left spin systemically. If you've tried to detox a patient and they got worse, they're in left spin. All right, so I want you to get familiar with this left spin concept. If you're muscle testing, as many of you know, I've worked extensively with a company called Physica Energetics, and in their test kit, there's actually a left spin test vial. Now, in that test vial is a collection of different glycols. So why would we start talking about glycol? Well, if you think about the design of an mRNA drug, it's in a bath of polyethylene glycol, or PEG. Polyethylene glycol is also Miralax, which is a laxative. So if you take polyethylene glycol and you turn it into a nanosphere type liposome, put it in a drug, not a supplement, but now you're taking a laxative and putting it into a liposomal base as an injectable. When you inject that into the body, you're going to create a systemic left spin situation. Essentially, when you inject that, you're going to create a massive electronic trauma. Okay, so the photons of the cell are going to panic. And what we're seeing so far is when people receive these medications, injectable, they have an acute response, which is kind of what you want, but they don't understand what's happening. So if they've received 1 or 2 doses of this type of medicine, their system has gone into left spin. I can't say it any plainer than that, but we're guessing roughly 200 million Americans will be put into left spin this year. So I hope you understand how to correct them. And the easiest way to understand this is to test everybody and realize that if you're in left spin, you can't heal, because all of the healing techniques that you would apply will backfire. So now you're thinking, okay, every Lyme patient, every mono patient, every parasite patient, every anxiety, depression, manic, basically every person that walks in your door, you need to start screening for left spin. Left spin blocks all natural cell function. Okay, it prevents cells from healing. We're in the business of healing. So this is a major blockage. This is like step 1 or 2. If you're muscle testing, check for left spin, get it out of the way. What's crazy here is systemically, the whole system can be in left spin, like when you are stuck with an injectable, but a specific organ pathway can also go into this crisis. For example, the liver can go into left spin itself. So the photonic arrangement in liver cells can be stuck in this acidic mode. The kidneys can do it if you give nutrition the body doesn't like. The hypothalamus is actually dictating this whole process. So let's take a look at how this works, because I've talked about this before and sometimes we get confused. I want you to stop thinking electrons. I want you to think photons. Why are photons so cool? Because plants turn photons into energy. And we use the energy that the plants captured to turn into medicine and help our biochemistry. So we want to be in right spin. We were born in right spin, right? We were born alkaline. We're going to perish acidic. That's how the life cycle goes. So if we can keep this system right spinning in an alkaline bath, then the cells can do their job. there is nothing more acidic than fear and stress. So we should remember the emotional component here, okay? Fear is a 4-letter word. One of the reasons many of your patients are going to be in left spin is they're afraid, genuinely afraid, okay? If you're practicing homeopathy or biotoxicosis or homotoxicology, this is right up your alley because we're talking about healing the extracellular matrix. And the hypothalamus is in charge of all this. So the hypothalamus is going to tell your body, hey, body, we need to control the flow of this potassium ion across the cell membrane. So you think a head injury might be important to look for? Because any trauma to this basically central nervous system could plunge the system into this acidic left spin situation. So if you don't have a healthy hypothalamus, you can't fix this long term, which is why in the past, for the last 20 years, we've talked so much about the HPA and how you have to feed the hypothalamus, the pituitary, the adrenals, the thyroid, and you've got to get this nutrition across the blood-brain barrier. Okay. How do you get nutrition across the blood-brain barrier? Well, many times you need a carrier. My favorite carrier are bioavailable curcuminoids, aka turmeric. So if you're using the third planet turmeric, we know it crosses the blood-brain barrier. We've got the research to support it. If that's new to you, I want you to revisit the webinar on turmeric. It will carry nutrition across the blood-brain barrier. So we can use it to piggyback things into the hypothalamus, into the pituitary, so on and so forth. Kind of slick, eh? So we want to get people back to right spin, not left spin. If you need another way to muscle test, or you're doing TCM, traditional acupuncture, you can use the triple warmer point on that finger. Okay, right there. If you don't know anything about acupuncture, but you're good at muscle testing, all you need to do is touch that point when you challenge any strong muscle. If the muscle goes weak when you challenge that point, you're probably in left spin. All right. So that's an easy check. If you are doing acupuncture, you know where I'm going with this. But for those of you that understand kind of how this is sliding, TW is triple warmer, which is HPA. So the Chinese knew about this forever. And when you're doing traditional Chinese medicine, an artful and master of Chinese medicine knows how to not make people sick by treating them. Okay. What's happening in America or in the West is some Chinese medicine practitioners are able to create a bit of a healing reaction. And they can say, look what I did. Look, we've got you healing. You feel horrible. Isn't that great? No, it's not. So challenge the triple warmer 1B point. And if you ask around, I know somebody probably has a muscle testing vial for triple warmer 1B because I've seen it. You can use that as a left spin filter. Okay. If you guys are just kind of thinking, what's he talking about? I don't know, understand filters. Go to a TA session, go to a tutor session, study group. You'll find out more about this left spin stuff. So the first thing you got to understand with left spin is you need to balance the pH of the extracellular matrix. And one of the first people to ever figure this out was René Canton. Now, the pronunciation of Quentin, all right, is a hot debate amongst our naturopathic friends. But if you watch the YouTube on this particular product, and it's in French, it is Canton, which is horrible because as a Canadian, I speak French, and even that sounds bad. So we'll just go with René because René sounds great. So what Rene was doing back in the day in late 1800s is he noticed in this certain region of France, people were really vital. And his research led to looking at what they were doing. He noticed that the seabed was very rich in certain minerals, so on and so forth. So you can see where this goes from a food philosophy. But fast forward, today, the legacy of Rene is that his marine medicine group is continually studying these two tools. And what he noticed back in the late 1800s was that when people would drink this basically sterilized seawater, they would have a boost of energy. They would feel amazing.
Mhm.
You know, whether they were hungover or worn out, they'd have a hit of this stuff, smoke a cigarette, they'd feel great because, you know, it's France, it's 1900. So what he didn't document, because technically physiology wasn't necessarily his passion, is he didn't document and ask all the questions as to specifically why does this happen. What we know today is when you take the hypertonic solution here, which is high in sodium, which is a seawater solution, you thrust the system into right spin. You create an alkalizing effect. You tell the cell, hey, cell, it's okay. Let a little potassium out. We're going to bring in some sodium. We'll clean the place. So the hypertonic becomes a brilliant tool for anybody who's in left spin. But I would also recommend it if you're going to receive one of those new authorized injectables, that you use the hypertonic to help the system protect itself. Rather than having a crisis, you can create a negotiation with the hypertonic, okay? So if you're going in for your injectable, first or second dose, want to bring the hypertonic with you. And the people at Aduco can give you the details on how this works, because if you notice, these are in glass. All right,
Yeah.
this is fancy stuff. Now you can get it in different sachets, but the glass is the best. All right, and Justin's got some right there. I know you didn't expect us to start talking about doing shots, right? Those aren't the shots you're looking for, but these are the shots you're looking for. So this is the hypertonic solution, which allows the cell to stay and maintain right spin. Now, this is just step one, because once you've told the body, hey, you mean I wasn't doing a good job? No, you need to stay in right spin. You need to stay in that alkalizing environment. When the cells agree to stay in that alkalizing state, the immune system is able to work quicker and more efficiently. And more importantly, your cerebrospinal fluid is able to balance its minerals, which allows the blood-brain barrier to do its job better, which allows the lymph of the brain to drain. And that should clear a lot of people's neurologic side effects from all of this stuff. So we've been using this concept of a hypertonic solution, and it's working. It's brilliant. Now, if you're using any kind of IV therapy, even if it's hydration IV therapy, I recommend that you use the hypertonic and the isotonics. There goes Justin. He's doing a shot. Everybody, you should be jealous right now, because if you've never tried this, it's literally like a true 5-hour energy. All right, you are lit up and ready to go. But if you're doing IV hydration, I would recommend using these two products between IVs to maintain hydration. Remember, hydration isn't a story about water. It's a story about getting water in the cells. If you drink dead water and you're in left spin, all you end up doing is putting fluid between the cells. And that creates things like pitting edema, swollen ankles, gouty-like symptoms. Anybody else seeing a boatload of gout right now? Or gout for our people trapped in the north? It's very gooty. We're also seeing an epidemic of anxiety and fear-induced gout. Remember, your classic symptoms of gout are going to be sore knuckle on the toe, maybe an elbow, maybe a knee, maybe a thumb, sometimes shoulders. Our simple muscle test for gout is you put both arms up at your side, so you can see me here. Whee! Both arms up, and both thumbs go down. If you can't hold your arms up in that position, chances are there's a gouty type process happening. That's an old CRA test from Dr. Dick Versendahl's days. So basically, you're testing the posterior delt with the thumbs down. Wouldn't it be great if we could do this live someday? Those air miles aren't going to spend themselves. But anyways, what I've noticed, because we're using IV therapy in the office now, is when somebody has had a bad bout of infection, whether it be viral, parasitic, bacterial, if they're a long haul type infection person, when you start putting in good hydration vis-a-vis this type of technology or IV, the symptoms go away within 20 minutes. We had a gentleman new to the practice on Monday. He's had COVID for 10 months. He just can't shake it. Old guy, doesn't do anything naturally, right? He's all new to this. He just heard that we've helped people and he just wanted to get an IV. I just want an IV. Don't talk to me about anything else. I just heard that this might help. So he's been coughing for 10 months. Within 20 minutes of doing a hypertonic solution orally and doing just IV hydration, his cough stopped. His system was locked in that left spin environment. It couldn't heal. Essentially, the system had crashed into a pause mode. So that's another clinical pearl for you. If you see people that just can't get unstuck, chances are they're in left spin. All right. Now, if you are using IV technologies, you need to use something like the Photon between your IVs to maintain what's going on. All right. So ask around with your colleagues. If you know patients that are getting IVs, once a month, twice a month, ask them what they're doing between, because the art is not the IV. It's what you do between the invasive medicine. Okay. Keep that in mind. Some other tools I've noticed that are helpful, though, include glutathione and vitamin C. We've talked about those extensively, and we've got those in liposomal form from Quicksilver. So when it comes to dealing with these left spin stuck people, you have to start with the hypertonic and isotonic, and then you have to start looking at how do we maintain this. You can use glutathione, you can use vitamin C, you can pick your favorite super greens drink, right? Because now you're thinking, well, what else causes alkalization? Those do. Now, this isotonic side, if you've been staring at this slide, you've noticed that the amount of sodium is much different. Okay, it's about a fifth. But then we've got these other ionic minerals in spring water and filtered seawater. So this is purified, whereas this is more sterilized. All right, there's a slight difference there. And if you want to know more about that, you can go back and talk about terrain theory and the battle between Louis Pasteur and Antoine Béchamp, right? So one is yellow, one is clear. I mean, it's as easy as it gets. But ask some questions and read about this stuff. This is old stuff. And I'm pretty happy that Chris Shade was able to bring this in under the Quicksilver brand. So he is kind of our gatekeeper to this marine technology. And this is the original seawater supplement.
Yep. We've been calling it Photon.
Photon, yes. So watch the YouTube. I like Photon, but when it comes to naming things, as you know, be consistent, right? So I like to say Renee's little ampule because it's elegant, right? It's French. You have to be elegant and a little bit mean. But dollar for dollar, some people are like, oh my goodness, it's so expensive. Your cost to patients is just a little over a buck per vial. How much does 5-hour energy cost per vial? It's a couple bucks. So not only is this cheaper than 5-hour garbage, it actually works and it's good for you. So if you have people that are using 5-hour energy, or they have to have that double down Mountain Dew in the afternoon, that's putting them into left spin. This will give them a boost and bring them into right spin. Also, migraines. If you're getting migraines consistently the same time of day, you're going into left spin in that moment, and that's typically hypothalamus. And you might want to look at the hypertonic and the isotonic to break that cycle. So the other thing you can do here, because these are in glass, all right, and there's a reason for that. In my world, when it's in glass, it will carry photons even better. So you can laze through this. So if you say you find the liver is in left spin, pull out your handy dandy laser, take a vial of the hypertonic, put it over the laser, and shine the light through the vial into the liver. Not only is this now your supplement, but it's also a test vial. Just be careful. Don't drop them. Handle with care. They do come with little things to handle them in, but you can use this with a laser and it works brilliantly.
And it's a whole lot of fun to drink anything out of a vial. Yeah.
It's
Or
elegant,
an ampule. Yeah.
right?
Yeah.
It's like a lightsaber. It's an elegant weapon for a more civilized age.
Do you find the hypertonic to be more on the sympathetic nervous system side and the isotonic on the parasympathetic?
Yeah, let's talk about that, because the sodium for the hypertonic is going to really touch those adrenals. The isotonic with the magnesium and the calcium, that puts the adrenals to bed. So like I said, this is more your 5-hour energy.
Right.
If you want to get down and dirty, I actually have a call with the Aura Ring people and their science officer coming up next. And we were looking at options when somebody's heart rate variability is too high. They've gone parasympathetic. This is what I recommend, that we look at isotonic. And if their heart rate variability is too low, hypertonic. But if they're not sleeping, you might do this in the morning, this in the evening.
Yeah.
So expect to get a call from Aura at some point, Justin. I'll keep you posted.
I'm wearing one right now, so send them my way.
Hey, this has been a long time coming, man. They're in San Francisco. We've been, a patient of mine is now their brand manager. So
great.
Anyhow, please experiment with isotonic and hypertonic solutions. Now, I mentioned the hypothalamus, and as you know, if you've been doing this a while, the hypothalamus is playing a lot of roles. It has a lot of hats. And we've talked about these feedback mechanisms. We've talked about the endocannabinoid system and how all that works with the hypothalamus. But the hypothalamus is also very sensitive to electromagnetic disturbances. So for those of you that have patients that are really wonky with EMF, you might want to look at how that's causing a left spin and start bringing in hypothalamus fuel, nutrition. So in this case, we have good, clean hypothalamus trophic extracts, 145 milligrams of clean hypothalamus, which is what we want. Your price point on this is ridiculously good. And it's in a tablet form. My suggestion with this particular product in tablet form is you do chew it, because we're trying to get the cytotrophin extracts right into circulation. Now, I know you're thinking, Doc, come on, who's going to chew this? This is going to be horrible. It's not that bad. If you've ever eaten a hot dog, come on, we're talking about meat here. So it's not in a capsule, because you don't want this necessarily sitting in the gut. It's hypothalamic. So chew it, goes through, boom. Now you're feeding your hypothalamus. Somebody who's chronically going into this left spin idea is going to have something wrong with the hypothalamus. There's miscommunication somewhere. In my experience, all chronic concussion symptoms can be traced back to a post-traumatic stress response. And you're not going to solve that with therapy alone. You need to feed that organ, and that organ's the hypothalamus. So that's where this comes in. You also have to realize that in a PTSD state, the system is in shock, right? And shock lives in the corpus callosum. That shock will tell the hypothalamus, run! And it's running. And when you're running like that neurologically, the system's in left spin. It shuts off detoxification. It shuts off repair. It's only interested in survival. And that's probably why a lot of people just don't feel good, because they can't repair themselves. They're trapped in left spin. Any chronic neurologic condition typically does well with the isotonic and hypertonic solutions and hypothalamus support. Now, botanically, for my herbal friends, don't forget about things like rhodiola and ashwagandha. Both of those need to be layered in to support this, so you don't flip back into that PTSD. So the first step with PTSD is recognizing that it exists. It's not necessary to know where it came from. Just understand that it exists. How many people are going to have a PTSD every time they look at their phone? CNN, breaking news. Now what? Ah! Throw it. Seriously, put your phone away for a while. The world will go on. I don't care what just happened or who said what. Your patients are having micro PTSD every time they get an alert. And the research on acoustic stress is becoming more and more prevalent. We now know that loud noises can cause heart attacks. Great. We got to pay attention to these things. So stay on top of your research and realize that all of these new findings we've already known, and you can modulate that reaction by keeping the patient out of left spin. The Western diet puts people into left spin. Coca-Cola causes left spin. Really cheap beer causes left spin. Okay. A lot of the habits that we have disturb the hypothalamus and cause left spin. Any kind of trauma will cause left spin. Do you think getting an injectable against your will is traumatic? It is. One of the secrets to dealing with vaccine injury, particularly in children, is understanding that they perceive that injectable as a trauma. So if you're stuck with a client who has a vaccine injury, try looking at it from a trauma point of view. When you back out the trauma of that event, the body can start to heal. But all vaccine injury begins in that left spin response, which is why we're talking about this today. And I don't just mean what's available today. I'm talking about, I've got patients that still have Guillain-Barré syndrome or GBS from the swine flu vaccine back in the 70s. We have patients, myself, I've been injured by a yellow fever vaccine. So we have to constantly stay on top of these things to keep our body healthy. Because if we don't do it, who's going to do it, right? If you're not healthy, how are you going to help people? I mean, that's the real question at the end of the day. So not to beleaguer the point there, take care of you so you can take care of others. And that starts by, using some supplements. Moving through the system here, you're going to find mold is also a major player. People with mold toxicity are more prone to these reactions to injectables. I know you've had some good presentations on mold before, but remember, if you're suspecting mold, you're right. It's there. The question is how much. So when we run mold panels here in the Great Lakes area, everybody comes back positive. And so you have to break it down by mycotoxin. And that's why I'm still in love with the push catch idea, because the binder in the push catch helps grab those mycotoxin producing materials and allows you to eliminate it. If you're doing a detox program without having that type of binder technology, you run the risk of triggering a left spin situation. So whether it's active binder or ultimate binder, you've got to use something when you're detoxifying patients to catch the bile and the waste material that's coming out. If you've got patients that just don't make sense, check them for mold, check them for yeast, check them for mycotoxins. Every estrogen dominant patient is a candida patient. All right. And remember that all of this circles around methylation, and that the gallbladder is the most methyl sensitive tissue in the body. So if you're doing detox, you better pay attention to this stuff, because you're going to trigger a problem. Which takes us into the whole neurologic side of what's going on with people. If this is your style of practice, there's an infection. You better find it. We've got some really cool new tools to kind of stir up the dirt and look for these infections. So I'm not going to do a whole lot on what are these cloaked infections. You already know them. Cytomegalovirus, Epstein-Barr, parasites, different types of molds, Lyme disease, herpes is a big one. If this is your classic patient, you've got a parasite on your hands, and it's parasite season. Okay. Now, I was in San Francisco 2 weeks ago, and what the heck, man? It snowed, right? I'm driving down the 101 in San Jose, and I'm like, it's a whiteout. Give me a break. I didn't get in an accident, but everybody else did. So spring is in the air, although it doesn't always feel like it. And spring is when different types of parasites like to poke their head out. So what's going to happen this weekend? We got a full moon coming up, don't we? When do parasites love to rear their ugly head? Around the full and the new moon. So let's pay attention to that, because you have tools for parasites. And remember that that ultimate binder likes to grab these little critters when they stick their head out. But wait, there's more. What's up with roundworms being able to perceive frequency? So Justin talked about this vitalistic nature behind Third Planet, and pretty much in every decision that we make today. What we're understanding now in physics is that, and this is from the physics people, not the biologists, all right? This is physics. The physicists are saying, you biologists, you're too slow, get with the program, come on, right? If you don't understand quantum mechanics, you're not alone. Roundworms perceive wavelength. They don't have eyes, they don't have ears. Their sensory receptors are frequency sensors. So worms perceive wavelength. That might be why when you're muscle testing people, you don't always find the worms, because they're hiding. They can mimic their wavelength. They defend themselves by perceiving wavelength and running away. If you're using frequency medicine, whether it be a sound generator or a Rife machine or a PEMF or lasers, you can actually drive these things and then you will see them come up. The good news for us is plants already have their own frequencies when they were produced properly. The idea is to take that plant medicine, capture its essence. When you ingest it, those frequencies also come with it, and we can check out these roundworms. And remember, roundworms and Epstein-Barr always go together. So chronic EBV patients typically have a roundworm exposure somewhere, and there's always an emotion tied to the roundworm. So these worms are attracted to different emotional dissonances. Okay.
Wow.
Love to do this live for you, but just let's plant that seed that worms can read frequency. Isn't that cool?
Yeah, for sure.
So I bring that in because mental illness is kind of an epidemic. When the brain goes into left spin, you lose your ability to rationalize. And what we've known for the last 30 years is that depression is more than just a neurotransmitter problem. It's an inflammatory problem, and it can also be driven by all of these stealthy little buggers. So pay attention over the next 10 days to the mood of your patients, your friends, your family, and anybody else you're talking to. If somebody all of a sudden develops acute depression or acute anxiety, and they didn't have a head injury, check these bugs. All right. Kind of a big deal. We've also talked in the past about the obesity connection to mental illness, because obesity is inflammatory by nature. People who are morbidly obese are naturally in a left spin state. And one of the reasons people lose weight on a detox, if it's done correctly, is you're putting them into that right spinning alkalizing nature. So when you alkalize the system, they're going to lose weight. The reason I'm talking about it now is because the other thing that's big in practice are the mycoplasmas rearing their ugly head. Most common that you'll see is Mycoplasma pneumonia, and you'll see things like central nervous system issues, Guillain-Barré syndrome, meningitis type autoimmune symptomology. I bring this in real quick because, as you know, an injectable technology that's authorized, not approved, comes with unwanted ingredients, and mycoplasmas are typically there. So keep an eye out for these things. If you muscle test for mycoplasmas, start checking everybody on mycoplasmas. They're going to show up. And the one that I'm seeing from our lovely new virus on the block, the vid, is the Mycoplasma salivarium, which will often show up as sudden onset arthritis, TMJ, eyes and ears, gingivitis, any dental stuff that pops up out of the blue is typically mycoplasmic. So wait a minute. Mycoplasmas, neurotoxins, they're all related and they're feeding each other. Start with a push catch. Fix the left spin with some good, clean isotonic and hypertonic mineral baths. Be nice to your hypothalamus and keep asking good questions. So from 2001, gliotoxins are the #1 toxins formed in dental infections. That's a mycotoxin, which is why you got to get after the mold. These things create left spin. By shifting into a right spin, the body will start to address these on its own. But if you haven't checked your teeth in a while, you're going to be shocked. Because when you look at what the teeth are related to, things can go south real quick. So if you've been wrestling with liver, gallbladder, liver, gallbladder, liver, gallbladder, holy moly, liver, gallbladder. Each tooth has a connection to a meridian. You know that. You've seen that. Remember, the tooth does not cause the dysfunction. The tooth creates a interference to that organ system. So if you've got a bad tooth on, say, number 16 over here, way over in the corner, small intestine. If this tooth is bad or cavitated or has a root canal, or you don't even know if it's bad, but you have chronic small intestine issues and you can't seem to get ahead of it, you might want to check that tooth. Because how many times have we heard of people having a bad tooth removed and their rheumatoid arthritis went away, or their headaches went away, or their ovarian cysts went away? I've seen tumors go away. And it's because of research like this. When I talk to you again in April, I'm going to do a little bit more work on this, but I want you to understand that stress, left spin, chronic anxiety, and grinding your teeth at night leads to undue inflammation on the back teeth. And I recently had a scan done called a cavitat, which is, of course, banned in America, but it's an ultrasound. And my new dentist, who's been around, as long as Moses, I think him and Moses went to school. They've been around so long. But so the ultrasound, the jaw, and my teeth are great. He's like, wow, your bones are amazing. But that wisdom tooth, man, that's a mess. I'm like, what wisdom tooth? I had it removed when I was 16. He says, well, not all of it. And he showed me on the screen, and I have a honking cavitated infection on a tooth that's not even there. So you want to check it out, which takes us to the cat's claw. Ta-da! We've made it. Why are you not using liposomal cat's claw? It solves so many problems. Why? You're thinking, oh no, not another cat's claw. This is the cat's claw. This is what you want. So you know about cat's claw, right? You need good cat's claw. You need the right priest at the right time under the right full moon in Peru to pick out the right cat's claw. Sure. But from a neurologic point of view, that's not that important. Neurologically, we need the alkaloids. So what Dr. Shade has done is find us some good cat's claw, make it nanosphere liposome. We're going to get that T cell immunity going, which we want. But we also want it orally to start breaking down some of the biofilms, start healing those cavitated infections, get after the mold, get after the parasites, get after the spirochetes. They're all in there. Start helping the sinuses. After all, we know COVID starts in the sinuses. Make robust sinuses. This is a great way to start. He also put monolaurin in there. As you know, you might have heard the product lauricidin. This is monolaurin from coconut. It's very targeted for biofilm caused by candida and strep. This is your anti-cavity product. Little vitamin D, and then wouldn't you know it, key essential oils in a liposomal form. That's what we want. So now you're thinking, well, if I oil pull with this, that would be brilliant, wouldn't it? Why isn't everybody doing this? Cat's claw inhibits arthritic inflammation. This is what's happening to people. This is a missing link for them. You need to play with this particular cat's claw yourself. You need to put it in your mouth and swish it around and feel what it does to your gums. If you're using essential oils in practice, this is how you dose essential oils orally in a liposome. Okay, it's nano emulsified. So it's $50 to the patient. You're only taking 2 pumps. So there's 50 doses. Before you start dosing this hot and heavy, hold it in your mouth, hold it in your gums. If you oil pull with this, you're going to see major changes in your oral health. You're going to notice your microbiome is going to change. Okay. And all the benefits of cat's claw for the brain and the nervous system come with this. So you've heard me talk in the past about viruses and how the brain reacts and creates unwanted side effects from viruses and vaccines. This is the perfect tool for post-vaccine injury. All right, read the tech sheet on it. It's pretty wild. The other tool you may not be familiar with is Dr. Shade's Microbe Manager. I don't know, Justin, have you had any experience with this at all?
Micromanager?
Yeah,
Sure.
Microbe Manager. Yeah. So
Yeah, sure.
for those of you that haven't used it yet, when you look at what's in it, you're looking at the label. You're like, oh, I got that. I got this. I don't need that. I've seen all this before. Right. It's $85. Why do you think it's $85? Because it's worth it. All right. In 2 soft gels, you're getting all of this. Let's walk through it. Real hemp, cannabidiol. Okay, that makes sense. We're going to be laying waste to bad guys in the belly. You might want to soothe the belly in the process. Brilliant. Here's your artemisinin, which you know all about, hopefully. Good dose of berberine. Some curcuminoids, primarily oil. So you'll dose the third planet turmeric phytorib with it. Boswellia, you're familiar with, but a whole whack ton of silymarin. 80% of this milk thistle seed is silymarin. That's a lot of milk thistle. Real quercetin, real andrographis, cinnamon. So this is the assassin formula that will get after those hidden infections that everybody's got. This is how you're going to poke the bear. This will disturb the dirt. This will shake up the system. If you're muscle testing and you're not finding anything, put a test vial of this on the body and recheck. It's going to anger something somewhere in the body. If you've got a hidden infection, this will anger it and it will show up in your bioenergetic testing. It's a brilliant tool. You only need 2 pills. With these types of technologies too, remember you want to pulse these in. So you might do 5 to 7 days on, take 2 to 5 days off. If you bring this in with a push catch, take this on your days off with the push catch. So if you're going to do, say, 5 days of push catch, then take 2 days off, take this on the days off. That way you're constantly pulsing the system and wringing the sponge to get these things out. So the cat's claw pump, the microbe manager capsule, eliminate the need for about 15 different products. We just solved it. It's all we got to do to help people. Then you need to buffer some of the liver burden that's going to happen. So we've got NAC, and you've heard me talk about that. This one's cool because it's 1,200 milligrams or 1.2 grams per cap, which is a significant dose. Most NACs range from 750 to 900. So it's a heck of a dose. We've talked about MicroRev in the past. You can't talk enough about this, right? The immune formula is brilliant. If you're going after immune stuff, use it. You've got another source of binder here. For those of you that love bentonite, this is your binder. There's our push catch, our favorite thing. We can't keep this in house. I think everybody should be using this on a regular basis, even if you just do, say, 10 days a month. It's part of how we've always done things. Bitter receptors, support liver metabolism, and help the body get rid of that toxic bile. And when we chat next month, I'll show you some other studies and case studies on how this is radically changing people. For example, today's case, I'll just share with you real quick. Horrible COVID case, 65-year-old female, hates her husband. He's crazy. She should have died, but she did great. Just mild case of COVID 6 months ago. She still can't taste. She's also been coughing for 2 years. She's been on the MycoRev tonic at 4 caps a day. Her cough is gone. She got the tonic by accident. She was supposed to get the immune. Go figure. So it was stress induced. I had her chew some of the microbe manager. 3 days, her taste is back. So if you have people that still can't taste, go ahead and take something like the microbe manager, get it on the tongue, chew it, coat it. It's a little bitter, but they can't taste anyway. So, they'll call you. They'll say, oh my God, I can't stand the taste of this. You're cured. Problem solved. And then, of course, push catch. We've done a whole show on that, so I won't give you too much. Hopefully you're using it. But the binder is the key. The sauce is the magic. It all works well. Let's take some questions.
Okay, thanks, Dr. Brockenshire. I love this topic. Early on, looking at left and right spin was kind of my indoctrination into holistic viewpoints, and I love it as a chemist and into physics, and then how does it relate in our life? I have many questions here from practitioners on just how to test for left spin and right spin. And we've also done a series of muscle testing techniques over the years. One of my good friends and mentors, the founder of nutrition response testing, with what they called it blocked, switched, open regulation, closed regulation.
Right.
Are you talking about the same thing when you're talking about those types of principles?
In general, when we talk about, open and close regulation or different switch points, those are unique. Left spin fits in there, but it's not the same. It's also not polarity. But all of those sub-factors all go back to the same concept, which is the body is being prevented from being in a healing state, regardless of what you're finding. That's why NRT is so cool, because you'll find reasons why they didn't get better.
Right.
But left spin, right spin, this is more of a acid-base situation. This is more functional medicine. And that's why I showed you the triple warmer point. You can muscle test off that. You can get a left spin vial from Physica Energetics to muscle test from that. But go off your gut and your symptoms. Again, if it's the patient is just not responding, and you've checked everything, give them a shot of the hypertonic and retest them. It's old AK, you can administer in the office. We do that all the time, and then recheck. You can use the hypertonic as a test vial, but you might get some confusing response because of the reasoning behind that. So get yourself a left spin vial, or if you have an EAV device, you can actually hit an acupuncture point, and it will tell you, yep, you're in left spin. There's a left spin filter in most EAV software.
Okay, but the triple warmer, for those that are doing physical muscle testing, that's a great way. And I listed out kind of all of the presentation of a left spin, and also dietary factors and EAVs and all that kind of stuff. That's great. Okay. Another question. If you oil pull with cat's claw, do you spit it out like a normal oil pulling?
Yes. So if you're oil pulling, add 2 pumps of the cat's claw elite to your oil pull solution, and then spit it out. because that nano emulsion is going to capture some funk in your mouth. You don't want to swallow that.
Great.
So you're not wasting it because it is being absorbed through the mucosa. You just don't want to put it in the gut.
Okay. Lots of testing on left spin.
Mm-hmm.
Okay, we have one of our practitioners ask, she actually gave the hypertonic isotonic solutions to a 70-year-old person. She reported that her HBP rose. Would it be best if they just stayed with isotonic? I think she's saying the high blood pressure.
Yeah, and if the blood pressure went up, stick with the isotonic and increase the magnesium. Maybe get some Mighty Mag on board.
Yep, Mighty Mag 125.
Yeah.
Yep. Okay. From my laser Les practitioner, hi Les. Is there an imaging technique that can see the spin direction?
Yes, physicists have it. It'd be a photometer. So you can look that up on any physics journal about how they can look at photons in the lab. In the slides, they show you some images of the photons, but time prevented that. But if we get together live, we can go deep and dark. It's called a photometer.
Photometer, great. Okay, let me just jump to the other question screen. We had questions on wanting to learn about the Soluma, which is our LED low-level light device, but that's, I think, for another day. But we love light, and we do have the Soluma as part of our lineup. That's using infrared, red, and blue light. Let's see here. I have one practitioner, a doctor of veterinary medicine. I have heard of salt sol from Himalayan salt. Is hypertonic and isotonic similar?
These are ionic mineral solutions. The salt sol from the Himalayan company is more of like a sea salt gig. It's not going to do what the Quintans are doing, but it can be useful as a salt type replacement, but I wouldn't necessarily use it as a medicine.
Okay. Another question. I heard that quercetin is the natural hydrochloroquine.
Good question. Quercetin is not natural hydroxychloroquine. What quercetin does when it's made bioavailable, like Quicksilver does, is prevent a virus from replicating in mucosal tissue like the throat and the sinuses. But quercetin is also big in the world of NRF2 and sirtuins. It's also big in the anti-aging world. And wouldn't you know it, it's a weight loss supplement. But no, it's not a natural. If you want natural hydroxychloroquine, go with the micromanager.
Micromanager.
It's heavy duty.
That's right here.
Yeah.
That's great. We have a couple more questions. Just, it sounds like technique. So the first one from one of my favorite doctor in the South Bay. Could you show that gout tear again?
Yeah. Here, let me get in position.
See it on the screen.
There we go. I got 100 bottles of wine in the other day, and I'm in the wine cellar, so I haven't had a chance to put it all away yet. So we're a little cramped.
Okay.
I mean, it's not a problem if it's a solution, right? So standing or sitting, both arms go up. All right. Now you see my thumb. Oh, hang on. Thumb. There's the thumb. You need both thumbs down. Good. So both thumbs go down. And then you just challenge. If the arms collapse, chances are there's gouty inflammation. The other clinical pearl is in this position, a lot of people tend to bring their heads forward. It's anterior weight bearing. That's somebody in sympathetic dominance. So if you see them trying to fight back, their sympathetics are shot. So that's how to look at that. So bilaterally, you're testing the posterior deltoid, and you do that with the thumbs down. Just think, live or die.
Nice.
All right.
And maybe while you're still standing, Dr. Brockenshire, another practitioner just wants to clarify. She wants to understand testing off the triple warmer point.
Sure.
Is it a positive, negative?
So classic testing off an acupuncture point. So let's say you're using anterior deltoid, or you're going to use middle deltoid. So you got a strong muscle, okay? Then you could contact the triple warmer point, or the patient could contact the triple warmer point. As long as there's pressure on the point on the hand, if the arm goes weak, or whatever muscle, if that muscle goes weak, then that acupuncture point is dysregulated. And chances are that person's in left spin.
Okay.
Any acupuncture point, if it's kidney bladder 27, it doesn't matter. If you hit a triple warmer up here and a muscle goes weak that used to be strong, then that acupuncture is dysregulated. That doesn't mean bad or good. It just means information.
That's great. Well, that's kind of all the time we have. we went a little extra today. I really appreciate you sticking around for that. The fun of drinking out of ampules. I love that, and I love things that have are from cold water, sterilized from the deep ocean. I mean, how cool is that? And many of the other products we talked about today, I just want to remind everyone as practitioners, we're here to support you. I'm so happy that we got to spend this time together today. Take advantage of, if you select 4 of any of the products and or more in the next 24 hours, you can have 10% off. That's a special just for this live people. But go ahead and use them in your practice, your patients, and we're here to support you. So I just want to thank you, Dr. Brockenshire, for being with us here today. Thank you so much.
Thanks,
thank you everyone that joined and took time out of their day to learn more. And my name's Justin Toll, and I look forward to seeing you soon. Thank you very much.
Have a great weekend, everyone.
Bye-bye.